Good morning, everyone. My name's Tony Maritato. I'm a licensed physical therapist here in Middletown, Ohio, and I want to talk to you today about a CPM machine. So a CPM stands for continuous passive motion. It is the device that you see people after a knee surgery, like a knee replacement or maybe an ACL reconstruction. They place their leg in the device and the leg slides back and forth, bending and extending the knee. So a CPM, based on clinical guidelines and research, is not required for every single person that has a total knee replacement. And there have been videos that I've shared where I said the drawback to having a CPM is that's time spent on your back and not moving, not on your feet, not building strength, not building endurance. So there's definitely a cost, a physiologic cost to spending 4, 6, 8 hours a day in a CPM device. But I also want to balance that with saying there are people that are appropriate to have a CPM prescribed to them. And so I recently wrote an article. I'll share the link to that article down in the description, but I want you to know that you can have a CPM prescribed. Talk to your surgical team, see what their thoughts are on it. The doctor is going to make the decision, but you're still the most important person in the decision-making process. If you have a pre-existing condition that might cause excessive scar tissue formation or limited range of motion, you might want to consider getting a CPM. If you have a history of excessive scar tissue buildup, maybe you've already had a knee replacement or you had other surgeries related to other joints in the body, and you know that following those surgeries, you had a really tough time regaining the range of motion, consider having a CPM ordered for you. If you have any reason that you might be too weak following surgery, or you might not be able to get into physical therapy quick enough. There are places around the country that just don't have access to physical therapists, and patients are waiting 2, 3, 6 weeks before they're seeing a physical therapist following knee replacement. You might want to consider having a CPM ordered. So while, yes, it is true, not every person needs a CPM machine, there are people who are at higher risk for developing complications related to range of motion deficits. And those individuals should sit down and talk to their physical therapist, talk to their orthopedic surgeon, really get an understanding of whether a CPM would benefit them or not. And my goal for you is that if you have any questions or you want more information, let me know in the comments. I'll do my best to do the research to find the information you need, but you have to be your biggest advocate, because if you're not standing up for what you think you need, there's nobody else around who will. So I wish you the best. Let me know if you have any questions. I will catch you on the next video.